Thank you for joining us for this session of the YMCA's Community Virtual Health Fair. My name is Melissa Eagleton, and during this session, I will be talking to you about pelvic rehabilitation physical therapy, a specialty program that we offer within Mary Washington Healthcare's Outpatient Rehabilitation Department. I am very proud to say that I am one of the founding team members for this program, which we started in about 2009. Currently, we have 3 specialty trained physical therapists who provide pelvic rehabilitation services in our Stafford Medical Pavilion location. So we'll start by talking about what pelvic rehabilitation is. Specifically, we are all physical therapists who have gone on to specialize in the treatment of the area between the rib cage and the knees. So anything that has to do with pelvic or lower abdominal pain, whether it is related to surgery or not, low back, pelvic, and hip orthopedic problems, urinary incontinence, constipation or difficulty with elimination of stool, pain with intercourse, and these are all treatable problems for both men and women. Also, for women, we treat pelvic organ prolapse and orthopedic problems during pregnancy and the postpartum period. We do this by having patients come in for one-on-one sessions in which we start with a very detailed interview to really establish the nature of the patient's problem and what has brought them to physical therapy. Once we begin looking at the patient physically, we perform an assessment of posture and an orthopedic screening of the low back, pelvis, and hip joints to rule out any potential contributing factors coming from these areas. We also observe the patient's functional mobility, which is just generally how they move from one position to another. Much more specifically, we really look at bowel and bladder function. We start by asking the patient to fill out a questionnaire prior to the session. We discuss it very much in detail during our interview, and then we actually examine the pelvic floor for muscle tone and the ability to contract and relax appropriately to determine the influence that the pelvic floor has on the patient's bowel or bladder issues. To treat these issues, we generally employ a combination of muscle re-education, specifically the pelvic floor, which may consist of relaxation or strengthening exercises depending on the patient's presentation and needs. We also address core strengthening, which would be strengthening of the deep abdominal muscles and the gluteal muscles, and then also fixing bad habits, which is typically the most difficult part of our treatment. These bad habits typically include fluid management, which consists of trying to promote patients to drink more water and less caffeine and acidic beverages. We look at diet and making sure that the patient is getting enough fiber, whether it's through fruits and vegetables in their diet or if they require some supplementing, specifically because bladder health has a lot to do with bowel health. We also address breath holding and straining during activities and exercise to make sure that the patient isn't putting any undue pressure down on the bladder or pelvic organs from inside. And then we'll also look at bowel and bladder emptying habits, which sound pretty straightforward, but actually have a lot of tweaking that we can do to make things more effective and much easier. So let's look at pelvic floor muscle anatomy. The pelvic floor muscles consist of 3 thin layers of muscle that rest in the very bottom of the pelvis. They really look like a hammock or a sling underneath the pelvic organs that runs from the pubic bone in the front of the pelvis to the tailbone in the back. In this diagram, we're specifically looking at a female anatomy. The biggest difference between men and women, as far as this general picture goes, is that the uterus would not be present in a man, and he would have a prostate gland underneath the bladder. Here again, we're looking at a more detailed picture of the pelvic floor muscles from a different perspective. So in this Picture we're looking down into the bowl of the pelvis. So you're looking down into that bony pelvic girdle. And in this view, you can see the deepest layer of your pelvic floor and how it really lines the bottom of the pelvis to support those pelvic organs and also provide what we call the three S's of function. The first being sphincters, as they provide closure underneath the bowel and the bladder when we don't want to go to the bathroom, but open and relax those sphincters when we do want to empty. The second is support. So they provide support for all of the abdominal and lower pelvic organs that are sitting on top of them. And the third is sexual function, as these muscles definitely aid in sexual appreciation. Now let's talk about urinary incontinence. So remember from the previous slides that the pelvic floor muscles rest just underneath the bladder and can provide closure around the urethra to prevent us from having any leaking when we don't want to be going to the bathroom. There are multiple reasons that these muscles and the bladder don't communicate well and work well together, which can lead to urinary incontinence or leaking. There are three main types of urinary incontinence that we're going to talk about today. The first type is stress incontinence, which means that typically the person is experiencing leaking with activities such as sneezing, coughing, and laughing, and maybe even picking up something heavy around the house. The second type is urge incontinence, which is the one depicted in this picture, when somebody is having difficulty getting to the bathroom before they start to release the contents of the bladder. And the third type of urinary incontinence is mixed, which is a combination of both of those. So, specific to stress urinary incontinence, we're going to talk a little bit about treatment. Typically, what we find in patients who have stress urinary incontinence is that the pelvic floor muscles are weak or they don't specifically know how to activate them and use them correctly. So, typical treatment components include strengthening exercises for not only the pelvic floor, but also the deep abdominal and gluteal muscles. Everyone has typically heard of Kegel exercises, but no one really knows if they're performing these exercises correctly, which is where we come in. The best way to practice Kegels is either sitting or lying down and then trying to just lift and squeeze in the pelvic floor between the sit bones in the bottom of your pelvis. If you're doing this and you find that you're lifting yourself right up and out of your chair, then you're really likely using the wrong muscles. So, really focusing on squeezing and lifting in between the sit bones in the area that we refer to as the perineum. It is essential when you're performing Kegel exercises to make sure that you are not holding your breath, as this is counterproductive and does not allow your pelvic floor to work the way that it's supposed to. So, when somebody comes in with stress urinary incontinence, one of the first things that we teach them after determining that they are able to perform Kegel exercises correctly is the knack, which also can be defined as squeeze before you sneeze. Easy to remember because it rhymes. So, the idea here is that by squeezing in the pelvic floor muscles as you feel a cough, sneeze, or even a good laugh coming on, that you can tighten up the pelvic floor muscles underneath the bladder and stop any leaking from happening by holding those muscles as you complete that activity. Once the sneeze or the cough has passed and you let go of the pelvic floor, you should have much less leaking if that's something that you're experiencing, or you have been able to prevent it altogether. Some of the other specific things that we work on for patients who have stress urinary incontinence are exhaling with any type of exertion, which can include picking up a laundry basket or pushing a vacuum cleaner, or even during regular exercise. We encourage the patients to avoid Valsalva, which is bearing down and holding your breath, with functional activities, specifically things like getting up out of bed or out of a comfortable chair or couch. And then really stressing the importance of not limiting fluid intake. A lot of patients come in thinking that if they limit their fluids that going in that they won't have as much to put out. But this is actually not true. When you don't drink enough during the course of the day, your body makes a very concentrated urine, which is very irritating to the bladder and also still makes you feel like you've got to go to the bathroom more frequently than you would if you just drank your water. Urge urinary incontinence is a little different in that typically these patients will often have high resting tone, which means that the pelvic floor is a little tighter than it's supposed to be. It's holding tone, almost similar to if you were holding your hand in a fist for a prolonged period of time, which doesn't allow those muscles to work the way that they're supposed to. So, treatment here differs in that it really begins with stretching the muscles around the hip and pelvic girdle to make sure that, again, we don't have any external contributing factors. Relaxation exercises. The number one, my very favorite, is diaphragmatic breathing. If you would like to try this, just think about taking a nice deep breath in through your nose and filling up your whole chest and the upper part of your abdomen with air. The best way to make sure that you're doing this correctly is to put your hands on the bottom part of your rib cage, take a nice deep breath in through your nose, fill up your hands with your air, and then just slowly release that air through your mouth and repeat. We also focus on neuromuscular retraining, specifically to help patients learn how to delay when they're experiencing urinary urgency and then to hold until they get to the toilet and can eliminate as needed. We talk specifically about emptying techniques. Sometimes people are not emptying completely when they sit down on the toilet for the first time and feel like they need to rush back or have some leaking as they're walking away. So we have some strategies that we can employ to improve that. Again, we talk about fluid management as patients who have urgency and urge urinary incontinence are definitely more prone to limiting their fluids. Again, emphasizing the importance on getting in enough water over the course of the day. And then eventually we will resume the strengthening progression that we talked about for stress urinary incontinence, as these patients typically do need some strengthening as well. A lot of people have the misunderstanding that they have tight muscles, which must mean that those muscles are strong, but that's not exactly true. If a muscle is already in a shortened position, it makes it very difficult to generate a contraction or generate any power when you're trying to squeeze that muscle and make it tighter. And so we have to make sure that those muscles are really resting at an appropriate tone or length so that when the patient tries to do a Kegel or tries to contract their abdominals, that they're really getting a good response from the body. Lastly, talking about mixed urinary incontinence, these patients have symptoms of both stress and urge incontinence. So they're having a little leak when they sneeze or cough, and also are not getting to the bathroom quite in enough time when they need to. So, to treat these patients, we typically address the urgency first, trying to get those symptoms under control and making sure that the patient is able to delay appropriately. And then we progress into addressing the stress symptoms and more specifically into strengthening. Treatment may include any of the components for stress or urgency and urinary incontinence. So, if you're somebody who's experiencing any of these types of symptoms, this is how you can get to PT. You can see your doctor or nurse practitioner or physician assistant and request an order for pelvic rehab PT. The number on your screen, 741-2244, is the number specifically to call and register so that you're able to schedule an evaluation. Our pelvic rehabilitation program is located at the Rehab Services at Stafford Medical Pavilion location, which is just the building behind the Stafford Hospital at the intersection of Route 1 and Courthouse Road in Stafford County. The specific address and phone number are listed on the slide. We also have a sister clinic, Rehab Services of Fredericksburg, that is located on the Mary Washington campus. October was Physical Therapy Month, and this year's theme, chosen by the American Physical Therapy Association, was to choose PT, which just is a reminder that physical therapy can have a lot to offer as far as body mechanics, strengthening, pain management, and as you've learned today, even the management of urinary incontinence. If you would like any other information or have any questions about today's presentation, you are welcome to contact me directly. My phone number in the office, 741-9646, and my email are listed on the screen. Just mention that you listened in on today's session and let me know what you thought. I look forward to seeing some of you in the clinic.